Hello, I'm Dr. Laurie Glasser, a sports medicine physician, and today I'm excited to share 3 invaluable tips to keep cheerleaders safe and injury-free. My first tip is safe skills progression. It should be obvious, but I do see a lot of injuries because of not following this skill. It's really important to progress systematically and safely through cheerleading skills. Mastering the basics before attempting advanced maneuvers or skills is essential because one study showed that over 2/3 of catastrophic injuries in youth sports occur in cheerleading. So often when this happens, it's because athletes attempt advanced skills prematurely. Make sure you have the proper conditioning and technique, and if you're working in a group, be sure to select teammates with the same level of experience and use spotters during stunts. So remember, take your time to build a solid foundation, don't rush into complex maneuvers, and it's really all about mastering those fundamentals first. So tip 2, scapular stabilization. Before I explain this tip, I want to remind everyone that there are actually 3 joints in the shoulder. Everyone tells me that they know about the ball and socket joint or the glenohumeral joint. That's the main shoulder joint that everyone talks about. Then there's the acromioclavicular joint, which is in the front. But what I'm talking about here is something called your scapulothoracic joint, and your scapula are your wing bones. The reason why I'm talking about this is because strong shoulders are the cornerstone of cheerleading moves. And strengthening the muscles around your shoulder, especially around your scapula or your wing bones, is the key to not only improving your posture, reducing injury risks, stability for those bases, and for pushing off under those complex tumbling passes. We recommend exercises to strengthen the shoulder muscles. For example, we have the 3-way band pull-apart. Push-ups are some examples of muscles that can be targeted to strengthen the shoulder and increase your strong foundation, which is really crucial for your impressive stunts. Tip number 3 is landing technique. So many cheerleaders, like flyers, will be flipping through the air in those high-flying tricks and flips, and we have tumblers, and really proper landing technique is your ticket to injury prevention. So one of the problems that I see with landing is something that we call dynamic valgus, and it's when a cheerleader's knees cave inward and forward during a landing or a jump. It's really a major concern because it puts excessive stress on the knee ligaments, and it really can increase serious injuries, even ACL injuries. There's a lot of literature about that. Also, always prioritize soft landings with bent knees because straight leg landing contributes to injuries, sometimes really serious injuries, hyperextension injuries and ACL injuries for that too. So you want to engage your core and your side hips for stability. And just a point about your core is a lot of my patients tell me they don't realize this, but your core starts with your deep cervical neck flexors in your neck and goes all the way down. So that needs to be quite stable with landing. Your hip strength is really important, and it plays a vital role in cheerleading and landing because it contributes balance and flexibility for your moves. And we can increase our hip strength with exercises like glute bridges, which really stabilize your glute max, and band walks to the side, which can stabilize the glute medius, and that can ensure that you can cheer with confidence and safety. So in summary, remember that you want to have safe skill progression, essential preventing injuries in cheerleading. You want to stabilize your scapula, your wing bones, and you want to have proper landing with stable landing technique. And by incorporating these tips into your training routine, not only will you build a strong foundation and improve your technique, but you're going to reduce the risk of injuries. With the principles of sports medicine, we can promote a safer and more enjoyable cheerleading experience. And remember, if you have a sports injury, contact a sports medicine or orthopedic physician to help you.